Good afternoon, everyone. I don't know, my title might be just about as long as Chris's was there. So anyway, the academic achievement gap has really persisted for decades. And no matter what standards or accountability measures are put into place, how school financing is revised, no matter how effectively teachers can teach or how rigorous curricular may be, how we reorganize schools, all of these efforts, which are good efforts, they're sensible efforts, are going to be jeopardized if the students in the classrooms aren't motivated and able to learn. But yet, all of the school reforms to date have really overlooked an important and powerful factor that affects students' motivation and ability to learn. And that factor is what I've called educationally relevant health disparities. And that's what I'm going to talk about this afternoon. Now, earlier this morning, you heard Dr. Emden talk about how education predicts health. My talk's going to be about how health affects education. This slide's a really simple slide, but I think it's a critically important slide. It talks about just the reciprocal relationships between these factors. It's not how one thing affects the other. All of these factors have reciprocal effects. And with respect to both health and educational disparities, it's really clear that the underlying causal factors are rooted in poverty. And that also came up in the first talk by Dr. Wallace, where she talked about the importance of income redistribution. So I want to delimit what I'm going to say. I'm going to focus only on urban minority youth from low-income families. That's my interest. That's where my commitment lies. That's not to say there are not other youth, for example, in rural areas and other parts of the country, Native American youth, that have equally important needs, but my focus is on urban minority youth. I'm also going to only focus on school-age populations. But if there's one thing that's really clear, it's that those first 5 years of life before children even get to school are critically important in the trajectories for the rest of their life, and how their brains develop, how their personalities develop. Unfortunately, in the United States, we have a very weak infrastructure for preschool education, and I hope that changes. And I'm going to only talk about problems that can be feasibly addressed through schools. My talk's divided into two big parts. First, I'm going to talk about which health factors affect educational outcomes, and then the second part's going to be about effective and efficient school health programs. So, schools are expected to do so much, and there's a need to prioritize. They can't solve all the health problems, and it makes sense to me that they'll be most interested in health problems that have a direct effect on education. So I had used 3 criteria to establish priorities for what schools may consider focusing on. And those are the extent to which the health problems are prevalent and disparities exist, how much evidence there is that these health problems really have causal effects on educational outcomes, and then that we can do something about these problems through school-based programs. And based on those 3 criteria, I identified these 7 health factors that warrant consideration: their vision, asthma, teen pregnancy, aggression and violence, physical activity, breakfast, and ADHD. Now, that doesn't mean that every single school system should focus on these 7 things and that there might not be differences from one place to another. These are just some things that warrant consideration. And I think one of the things that's not up on this list, but it's really an underlying theme through all of these, because it's either a cause or a consequence of all of these things, is mental and emotional health. And that's really at the core of any successful school health programs. So I just want to talk a little bit about prevalence of these problems and disparities. All of these problems are highly prevalent. Vision problems are estimated to affect 1 in 5 youth. Asthma is the most common chronic disease affecting youth. That's about 14% of youth under the age of 18. That's about 10 million individuals we're talking about. A staggering 3 in 10 female teens is expected to become pregnant in the United States. That's among highest rates in any developed country. Violence is pervasive. About 28% report being bullied at school. The rates may be even higher than that. Physical activity is not sufficient in about 2/3 of the high school population. 1 in 5 skip breakfast on any given day. And inattention and hyperactivity is the most common mental and behavioral disorder affecting young people. It's about 8% of school-age populations. That's about 4.6 million youth we're talking about. By the way, any of you are welcome to have all these slides. They can be posted on your website. Please take them and use them in any way that you can benefit. As prevalent as all these problems are, all of them greatly disproportionately affect urban minority youth. This slide shows visual impairment in individuals 12 and above. You see that Black and Hispanic individuals as well as low-income individuals have much higher rates of visual impairment. This next slide talks about asthma prevalence. You see that the rates for Blacks are about 45% higher compared to that of youth. Now, asthma per se is not the real problem. What the real problem is poorly controlled asthma. And these same disparities, even greater disparities, are seen in poorly controlled asthma, as indicated by things like overuse of emergency rooms for routine care and underuse of efficacious medications. Asthma is a disease that can be controlled very effectively, but for many kids it's not. And then the last 2 bars on the histogram show the importance of disaggregating the Latino population because there's greatly varied rates among subgroups. Now, these are based on 2006 data. I'm sure the data have improved somewhat, but here you can see that the teen birth rates among 15 to 70-year-olds are 3 times greater for Blacks compared to whites and more than 4 times greater for Latino female teens compared to whites. And until we can make a measurable effect on things like this, it's going to be very hard to close the achievement gap. This slide shows youth that have been in a physical fight by race and ethnicity. You see these disparities exist again. And the next slide shows the number of high school students that say they missed 1 or more days of school just in the last month because they were afraid to be at school or travel to or from school. And for Latino youth, that's about 10% of the high school population. Missed 1 or more days in the last month because they were afraid to be there. Here we see the rates of physical activity, and we see that for female high school students, the rates are much, much greater among Black females and Latino females compared with whites. And now we look at breakfast consumption. And obviously, breakfast consumption is just a marker. Overall nutrient intake and dietary intake is really the key factor. But the data that are available really focus on breakfast. Here we see, again, disparities between Blacks and whites in breakfast consumption, 3 consecutive days of breakfast consumption. And you see from age 9 to 19, the absolute disparity declines from 20% to 10%, but actually the relative difference increases as youth age over time. And the final slide talks about disparities in ADHD diagnosis among school age or here slightly younger population, which is much more common in single mother head of households and households making lower levels of income. Now, everything I've said up till now, sadly, indeed tragically, is old news. There's nothing new about this. We've been really good at documenting these problems, and these problems have persisted for decades. But the next topic that I'm going to talk about is based on research that's largely been conducted just in the last 10, maybe 15 years. And that is, how and why do these health factors affect motivation and ability to learn? How and why do these health factors affect learning and the achievement gap? Well, there's at least 5 ways in which these health problems directly and powerfully affect the achievement gap. And they are sensory perceptions, cognition, school connectedness, absenteeism, and dropping out. Sensory perceptions, just things like being able to see well and hear well. And obviously we learn a tremendous amount of information through our visual systems and through our auditory systems. Cognition is about thinking skills. It has to do with things like memory, paying attention, solving problems, drawing causal inferences. It's pretty obvious that cognition is important for learning. One of the things on this list that's probably been the least appreciated, and Professor Chris alluded to it in his talk, is this notion that's been called school connectedness. And school connectedness is about the notion of the extent to which young people in school feel that their peers and adults in the school care about them as individuals, care about them as learners. Is it the place they belong? Is it a place they want to be? Or do they hate it? They just want to get away from it. And then obviously absenteeism and dropping out is fundamental to academic success. If you're not in school, you don't have those opportunities for learning. So one of the things that I'd like you to notice as we go through how and why these health issues affect motivation and ability to learn is I want you to notice that each of these causal pathways is affected by multiple problems, because that's an issue I'm going to come back to. But here, visual problems, largely in youth, are due to refractive errors, a problem called hyperopia, something that affects most of the people my age and older. And what it means is you can't see things at close distance without your glasses. And, reading, it turns out, is a very difficult skill to acquire, even when you can see well. But now imagine that the P's and the D's and the P's and the Q's are all blurry, and how much more difficult it's going to be to decode those words and learn the syllables and learn how to acquire those basic literacy skills. Well, if you look at the 58 lowest performing elementary schools in New York City, what you're going to find is 26% of them in kindergarten fail the vision screening. And then if you go back and screen them again in first grade, you're going to find that 60% of those fail it again, indicating they don't get the basic services they need. So I'm wondering, why is it that we can spend hundreds of thousands of dollars on chronic disease in people's last years of life, but we can't get a 5-year-old an eye exam and a pair of glasses? It doesn't make a lot of sense. Inattention and hyperactivity affects sensory perception with respect to time and perception of time, and time's important in rhythm. Time perception is important in a lot of different aspects of learning. For example, when you're trying to solve a math problem with multiple steps, let alone trying to figure out the Krebs cycle, or even write a story that has parts like first, then, finally, which to you or me might seem simple, but for somebody who's dealing with that perception of time issue, they get mixed up easily. Cognition is affected by 6 of the 7 problems. Here, visual problems are not sensory perception. It's about visual motor integration. It's which means the connections between your eyes and your brain. And this means seeing something up on the blackboard and then writing it down in your notes. Turns out writing things down in your notes is an important basic skill to succeed in school. If you don't have good note-taking skills, it's going to be harder to succeed. How does asthma affect cognition? It's not asthma, it's poorly controlled asthma. If you have poorly controlled asthma, you know what's going to happen? You're going to have a hard time falling asleep. And once you fall asleep, you're going to have a hard time staying asleep. So when you come to school the next day, you're going to be sleep deprived. I know a little bit about sleep deprivation. I have 6 children. And when you're sleep deprived, it's harder to pay attention. It's harder to stay alert. It's harder to learn. When you're exposed to aggression and violence in school, you're more distracted. It's harder. How can you learn algebra when you're worried about if you're going to get beat up after school? More intrusive thoughts, more distractions, more off-task behavior. It's been shown. This isn't controversial. These are not things I'm saying as an opinion. These are all documented in rigorous literature. Now, it's only about the last 10 to 15 years that molecular biologists and neuroscientists have demonstrated empirically what the Greeks really knew 4,000 years ago. And that's there's powerful, intimate relationships between the health of our bodies and the health of our minds. But now the neuroscientists have shown how through oxygen saturation in our brain and the uptake of neuronal factors and other neurotransmitters, physical activity actually has effect on our working memory and our attentiveness and our ability to succeed in school. Now, breakfast, most educators know that breakfast is important for paying attention, for alertness. You know, the school principals know it. They know it. You know how I know they know it? I know they know it because on the day before the test, they send a note home. And they say, make sure your child eats a good breakfast. You know what? It's probably a good idea those other 179 days too. Inattention and hyperactivity by definition affects cognition. It affects our memory. It affects our ability to pay attention. That's how the syndrome's defined. Now, how do vision problems affect school connectedness? Imagine a child with vision problems. What happens to them? If it's uncorrected, no matter how hard they try, they can't succeed. What's going to be the result of that? They're going to become demoralized. They're going to become disconnected. It's a demoralizing experience. They're going to disconnect from school. Children with poorly controlled asthma, too, have other comorbidities. If I have an attack in school, somebody going to know what to do? You know how frightening that is, gasping for breath and fearing that nobody's going to know what to do to help you? By definition, you know, if you're going to a school where there's meanness and there's disrespect and you're out of sync, people don't see the rhythm you're in, they can't relate to you, that's not a place you feel like you belong or you're going to feel any connection. It's a place you're going to want to get away from. Physical activity programs, while they're being cut in many places, are a golden opportunity to foster connectedness, to foster respect, to foster teamwork and collaboration. One of the saddest things I learned in the hundreds of papers I read about this topic was that children with ADHD, they don't have any friends. They have a hard time getting along, and a lot of times the way that they're treated is to make life easier for the adults around them. But it doesn't really help them academically or socially. Not controversial. Children with asthma have greater levels of absenteeism. It's not controversial. Nobody's argued. In fact, nobody's argued with any of these things. I presented it all over the country. Showed you the slide saying almost 10% of Latino youth say they miss one or more days of school in the last month. That's just the last month because they were afraid to be at school or travel to or from school. In schools where there's physical activity and breakfast programs that are working right, attendance tends to be higher. And children with ADHD miss more school, and they're much more likely to be late. One of the most dramatic determinants of school dropout is teen pregnancy. People have argued about this, but I think the evidence is very compelling. When a young woman becomes pregnant, she's much less likely to graduate from high school. A very, very, very small percentage of young women that become pregnant by the time they're 18 actually go on to graduate from a 4-year college. Children with ADHD are also much less likely to graduate from high school. So, what can schools do about this? I mean, are these problems that can be dealt with? Indeed they are. We're not talking about complex programs that have complex answers. What we're talking about is political will to do something about this. So, one of our doctoral students here at Teachers College, he happens to be in the audience, did a program to evaluate the effects on a vision program called Vision for Success. She said, you know what, maybe what we should do, we did this program in collaboration with the Department of Health, maybe what we should do is every child who fails a vision screening, why don't we just do the eye exam right there? And in fact, why don't we give them 2 pair of glasses? One to leave at school and one to take home. Because, you know, children are going to break glasses and lose glasses. And then why don't we also work a little bit with the teachers so the teachers understand when the child's which children need glasses and whether they need it for near work, far work, or both. And indeed, that program showed that we could double the rate of in-class eyeglass use. Okay? Asthma programs, all you have to do is go to the CDC website and you're going to find everything you ever wanted to know for how a school should develop an asthma-friendly school. And it has to do with case management. It has to do with nurses following up on the children that are absent who have asthma to see if they have an asthma management plan on file, to make sure they have an inhaler in the school, to recognize the different triggers that may be present in the school, which may be solvents, may be cockroach allergens, may be different kinds of pollutants in the atmosphere, in the air filters of the system. Because a lot of the schools are old. I know that. I went to one in the South Bronx. Providing safe opportunities for physical activity. Now, we get to teen pregnancy. Teen pregnancy is one of the most challenging problems to deal with. I think one of the reasons it's so challenging is a lot of times we start with these programs in junior high school. That's not going to work. Teen pregnancy prevention programs need to start in kindergarten. That doesn't mean you're talking about sex in kindergarten. It means you're talking about cultivating aspirations for life in kindergarten. It means you're talking about certain kinds of skills in kindergarten. And that's what it's going to take, social emotional learning. I'm balanced, I'm calm, I'm centered. Learning to cope. Because it's a stressful world we live in. I go past this sign on my apartment building on Morningside Drive every day, and I always get a chuckle out of it. The sign says, "Good morning, let the stress begin." And believe me, the stress that we have is nothing like the stress in the lives of the young people I'm talking about here. The young people that Chris showed in some of his slides and video. And we can't have our head in the sand approach. We need contraceptive services available for youth that are sexually active and programs for, despite our efforts, do become pregnant and have children. It's not controversial that universal violence prevention programs work. You could go to the CDC, you could go to the Community Preventive Services Task Force, and they'll tell you these programs work. They have to be put into practice. They create a supportive climate in schools. They provide a safe physical environment They have skill-based health education programs, and they provide counseling and psychological and social services to the youth who have been so traumatized and are so sad and so angry that sometimes that comes out as physical violence rather than being channeled in a more creative way. Physical activity programs are being cut all over the country based on the misguided notion that taking time away from these programs and putting it in more academic areas is going to result in better test performance. There's absolutely no evidence to support that. In fact, all the available evidence suggests that's not the case. Also, breakfast programs need to be available in classrooms where children can eat them, and they need to be universal so it doesn't stigmatize any youth for participation. Now, you know, I've been trying to get some funding to do this work for several years now, and it's been challenging. One of the requirements is that evidence-based programs have to exist in the populations that you want to work with. And I was struck by how little research has been done on ADHD, given just like what a pervasive and devastating problem it is. But the few evidence-based programs that I could find were not done in urban minority youth. They were done in suburban white kids, so I couldn't even use them to apply for this money. When you're talking about daily report cards and other programs aimed at improving academic achievement, there's been very little work that's been done. So, I have to ask you a question now. If a child can't see well enough to distinguish letters, is it reasonable that they're going to be able to learn how to read? You're going to have to, if we're going to create a social change in this country, you're going to have to muster some more energy than that. If a child can't see well enough to learn how to read, is it likely they're going to be able to succeed in school? No. No. I'm kind of becoming impatient in the United States because I'm getting old. And people have been talking about this for a long time. And there's little progress, but it's not fast enough. If a child can't get to sleep at night and get a good night's sleep, is it likely they're going to be able to pay attention? No. No. If a young woman, despite efforts, becomes a mother when she's 15 or 16 or 17 and doesn't have the resources and support to finish high school, is it likely she's going to be able to succeed in her educational career and compete in a 21st century global economy? No. Unlikely. If a young person goes to a school with his teasing, with his harassment on the school bus, with his hateful graffiti in the bathrooms, where you're not sure what's going to happen in the stairways, or after school 6 blocks away from the school, can you learn in that environment? I know it was hard for me to learn in that environment when I went to DeWitt Clinton High School in the Bronx, and that's what it was like. If you come to school on an empty stomach, how are you going to pay attention? Is it likely that you can pay attention and do your best? No. And if you can't pay attention, can you learn? You can't learn. Now, I've done this presentation all over the country for all different groups, and I always refer to something that stands out in my mind. I think it was one of the first times I gave this talk, and Barbara Wallace invited me to talk to a small group of people over in the library. And after the talk, Cynthia Green, the secretary in the nutrition program, came up to me and she said, "Chuck, that was very interesting, but doesn't everyone already know this?" Because it is. It's common sense. It's just common sense. Which leads you to the issue that, the reason this is not happening is because there's a lack of political will to make this happen. Now, as bad as all this is, this next point is an important one, and that is many people, many children, are not just affected by one of these problems, they're affected by multiple problems simultaneously. And that's why, in order to do something about it, we're going to have to address multiple problems simultaneously. And that's why, to do something about it, if we do one thing at a time, it's not going to work. So how can schools influence the health of youth? Well, there's been this growing attention given to this movement. And, Arnie Duncan's spoken out about it, and Kathleen Sebelius has spoken out, and, Randy Weingarten from the Teachers Union's, supportive, and Dennis Van Rokel, president of the National Education Association, and you could go to School Boards Associations, and Association for Supervision and Curriculum Development, and the state chiefs. So there's a lot of interest in this. But from my perspective, there's still, a limited investment, and most efforts in the nation's schools are not strategically planned, they don't use high-quality programs, and they're not effectively coordinated. So what does it mean to have a strategically planned program? Well, what I'm talking about when I talk about that is I'm talking about programs strategically planned to influence educational outcomes. And that's going to vary from one location to another. It might not be the same in Memphis as it is in Detroit or Los Angeles or Chicago or in rural areas, but there's a need for local folks to get together and figure out what their priorities are. This has to be an ongoing process. School health has to become part of the fundamental mission of schools, not something that is, marginalized or a peripheral activity. We're not going to achieve the success we have in STEM and literacy for the next generation of urban minority youth that will become the majority in this country if we don't address these issues. Schools can't address these issues alone. These problems are so big that there's a need for community involvement, a need for family involvement, a need for faith-based organizations, community organizations. But the school is where the youth are. And in my opinion, is the most powerful social institution we have and has become the de facto safety net for youth to do something about this in the most timely and efficient way. Unfortunately, some of the most widely implemented school health programs are programs that have no evidence of effectiveness. You look at the DARE program for substance abuse prevention. Not a lot of evidence of effectiveness. You look at abstinence-only sex education programs, which are the kinds of programs promulgated by our federal government. Not a lot of evidence of effectiveness. And it's not like there aren't effective programs out there. There are. And we could give you examples whether we're talking about tobacco injury prevention, teen pregnancy prevention, violence prevention. We know what to do. We have to do what we already know. Here's Substance Abuse and Mental Health Administration. They have a registry of evidence-based programs. There's a lot of good programs out there. Now, this last piece in some ways is the most challenging piece, the need for effective coordination. That means that there's different people playing different roles, but they're all working toward a common goal. The need for coordination, and I've suggested the way to achieve that is through having a designated school health coordinator. Not dumping that role onto somebody who already has a job like the school nurse or a teacher, but actually designating a full-time person. And I hope we can invent that career here at Teachers College. Tennessee is the only state in the country. Tennessee is the only state in the country that has funded, their legislature has funded to the tune of $15 million a year, having a school health coordinator in every one of their 140 some odd school districts in the state. They're way ahead. And these are some other ways to promote effective coordination. We need coordination of services for individual students, because think about it for a minute. The health department comes in and does the vision screening. Then they send a note home to the parents. The parent has to take the child for an eye exam. Okay, let's say they go for an eye exam, and they get their glasses and they don't lose them or break them. Now the teacher has to make sure the child uses the glasses in school. So who's going to make sure that child doesn't fall through the crack? Which is what happens in way, way, way too many cases. These are interrelated problems, but we have categorical, siloed solutions. Even worse, we have silos within the silos. So that you talk in the health silo about obesity, or violence, or sexuality, or substance use. It doesn't work. But yet that's how all the policies are constructed, that's how the funding streams are constructed, that's how the training programs are constructed. It's not how people are put together. We need a holistic, integrated approach. You see some of this, for example, in the Harlem Children's Zone, where you have this array of services under a single roof. And there are other examples. So, schools can't do all this. They're going to need a lot of help. So, I urge you to speak up about this. Communication is an important way to just increase awareness, increase attention. I'm always deeply disappointed by how little attention we get in the media on these issues. Why isn't the media covering these issues? Why isn't the media getting these issues on the agenda? These are important issues. You know what we're talking about? We're not talking about health and education. We're talking about national security here. We're talking about our economic future here as a nation. That's what this is about. We're also talking about fairness and civil rights. That's what this is about. Ultimately, it's probably going to take policy mandates and accountability to ultimately create change. And there's a need for financial support, although we're already spending lots of money very poorly. And there's a need for guidance, technical assistance, and professional development, because a lot of times the teachers and the school leaders in schools didn't learn this stuff. And you know why they didn't learn this stuff? Because they weren't taught about it in colleges of education. And unfortunately, they're still not being taught about it in colleges of education. And we do need data collection and research, and I'll talk about that in a minute. So I had the honor, great privilege of meeting with Secretary Duncan some time ago, and I kind of had a short period of time to try to lay out the case for this. And, I truly believe he got it and understood and cares about this deeply. And when I was through, he asked me, so why do you think this isn't happening? And I looked him in the eye and I said, well, there's a lot of reasons, but one of the big reasons, I think, is there's never really been any good leadership from the U.S. Department of Education. And that's sadly the truth. The people in education really see health as somewhere over here. And the people in health see education as somewhere over there. There's been a real disconnect. And it's changing. It is changing. There's greater collaboration. But it's not changing fast enough. So let's look at some of the priorities that the U.S. Department of Education has. They're concerned about the distribution of highly effective teachers. So what makes a highly effective teacher? Is that somebody who can recognize a young child struggling to see? Is that a teacher who can see a child in the back of the room who's just out of rhythm, even though they may have a brilliant mind, they're disconnected? Is that a teacher who knows how to prevent a bullying situation from occurring, not to mention dealing with it when it occurs? Who knows how to respond when a student might approach her with a pair of scissors in her hand? Is that child going to be suspended from school? Or is that teacher going to be able to, diffuse that situation. So there's a lot of opportunities here for effective teaching. We're supposed to be dealing with the transformation of teacher education here. Are we dealing with these issues? I don't think we are. There's a focus on the lowest performing schools. There's 5,000 of them in the United States. There's about 14,000 school districts, 100,000 public schools. 5,000 are the lowest performing public schools in the United States. Guess what? Go to those 5,000 schools. That's the same exact population where all these health disparities are going to be the greatest. It's going to be the same schools where the rates of uncontrolled asthma and teen pregnancy are going to be the highest. That's not coincidental. Improving data systems. We don't know anything about, school connectedness. We don't know anything about the extent to which children throughout the nation's school feel connected to school, even though that's an important determinant of success. We don't have any assessments and standards. We don't have any assessments in health. There's no Regents test in health. Well, if you don't measure it, it must not be very important. And, we have healthy people. What we need now is we need a national school health strategic plan. We don't have such a plan. We need a plan now. We need incentives for involvement, human capital grant programs, integrating school climate and connectedness into the ed data systems, and integrating health into the Institute for Educational Sciences research agenda. Kind of running out of time here. How am I doing there? Do I have another? 10 minutes, fine. Okay, so policy development is important, and there are some bright lights where policies have been created. For example, the city of Chicago has mandated that every one of their schools in the city include health goals in their annual school improvement plans. It's in the annual school improvement plan. At the end of the year, somebody's going to say, did you do that? That's a very significant policy change. And then what are our policies regarding sale of competitive junk foods in schools? What are our policies regarding curricular time for health education and social emotional learning in schools? How do you deal with disruptive situations in the school? So policy development is critically important. We need to support professional development for teachers and staff and address specific policies that will speak to these problems. Now, there's going to be a need for a lot of assistance because, as I said, a lot of times the teachers, they're reluctant to deal with these issues. They don't know how to deal with these issues. They're not prepared to deal with these issues. We just had a big survey done of middle schools in the Bronx on teacher preparedness to address bullying. You think teachers are prepared to address bullying? Ask them. They'll tell you they are not. They need help. They need assistance. They need coaching from people who know what they're doing. And this isn't like a one-shot session they're going to come to for 45 minutes or even 2 days. But it has to be an ongoing program because these are difficult skills to learn. And we need to have people trained in the schools who can provide that kind of assistance. Now, I'm a researcher. I've been doing research. I've gotten a lot of funding over the years, tens of millions of dollars in funding to answer questions. But the kind of research we need now is not to figure out what to do. The kind of research that we need now is to put into practice what we already know. We know what to do. We have to put it into practice and demonstrate its effects. Now don't get me wrong. I don't think doing all of these things is a panacea. It's not going to solve the problem and close the achievement gap. This is one piece of a more comprehensive approach. You still have to have effective teachers. You still have to have rigorous curricula. You still have to be able to use data to see, how to tailor approaches for individual students. But if you don't address these things, it's going to jeopardize the benefits of all those other efforts because the students won't be motivated or able to learn. So that's the kind of research that we need most desperately. Now, what's the role for the colleges of education? You know, I came here about 30 years ago, and the reason I was so excited to come here was because I thought, oh, this is the largest, most comprehensive, and some people might say best school of education in the United States. And I say, this is going to be the place. If not here, where? To influence national education policy. We need to do more. We need to do more. We need to speak out. We need to set a model for all the other colleges of education in the United States to show what is possible. How come we're not working with those 58 lowest performing elementary schools in the city? We need to do more. We are responsible for preparing the next generation of school teachers and school administrators. And we prepare more than any college in the United States, probably in the world. So how is that being done? People are looking to us. What example are we setting? I hope we can change the example we're setting, because I don't think we've been doing enough. And we've been struggling to do more for decades, and I do mean struggling. So I hope now's the time for change. This is a civil rights issue. This is a social justice issue. This is an issue that requires a fundamental change in the nation's schools. It's going to require tremendous amount of effort, and this is going to require a social movement. It's a revolution. But yet at the same time, it's relatively simple to do. It's in our hands to do so. The United States is unique in the world. Only one other country in the entire world has a decentralized educational system like we do. It's Canada. All the other countries in the world have a centralized system. Ours doesn't work like that. It's locally controlled. So that's why even though the leadership of the U.S. Department of Education is critically important, it's limited power to influence. Still, 90% of the funding comes from state and local sources. So it's going to take lots of local action, community action, to really make a change. Thank you for your attention. I hope this was useful for you, and good luck.
We have time for questions. And there's two options. Okay.
There's a lot of questions from the web. Do you want those?
Okay. Do you need a microphone? I will take it.
You going to screen them?
It seems like there is a major burden being placed on schools and teachers. I'm curious where parental engagement fits into the equation in the health and education interaction.
It's a great question. It's a great question. Schools should not be the social institution primarily responsible for solving these problems. There's important roles that families can and must play. There's important roles that community organizations can and must play. There's an important role that faith-based organizations can and must play, that government agencies can and must play. The reality is that where are the children? The children are in school. And it's just the most powerful social institution we have to reach the youth that are desperately in need of these services. If families were providing these services, there wouldn't be this much of a need. Those services are not being provided. The families are stressed. The families are overwhelmingly stressed and may not be in a position to provide the services that are needed. They need help. So clearly, these problems are incredibly deep, and they're not going to go away without involvement from all of the different social institutions with our society. Schools have a vital role to play, as do parents and families. And part of an effective school health program definitely involves parent education and parent engagement. So I fully agree with that. I just want to just follow up one last point on that, and that's to recognize that, well, a lot of times people say, well, wait, the role of the schools is educational mission. And my point is that if these issues are not addressed, it's going to totally jeopardize achievement of the educational mission. And to date, they really have not been well addressed. And I believe that's why we have jeopardized those and why we've had these dropout factories going on for decades, among other reasons. Sorry, yeah.
All right, thank you, Dr. Bach.
Oh, yes, thank you.
I actually had two questions. I'll just say the first one and then wait for the other one. So let's say with asthma, for example, I'm in a Fundamentals of Global Health class at the public health school here, and Professor Joseph Graziano talked about how, let's say, with lead-based paint, and it leads to, like, let's say, lower IQ levels, and like asthma is caused by it. And there's a lot of connective things that are directly related to academic achievement. And while, of course, schools can't be responsible for everything, but like, I mean, it seems like there's a real big need for political will to address, like, let's say, poverty issues and, like, the housing and transportation. So, like, what are your thoughts about that, and how do you think schools could play a role, even though they're limited resources?
With respect to the broader issues of poverty?
Like let's say, if children's IQ levels are lower because of their poverty or their housing situation, how can schools be advocates for the political structure?
Well, first of all, you know, the lead levels in children have dropped to much lower levels than they have in the past. But, you know, it's clear that housing is a health issue. There's no question about it. Housing is like kind of like hunger. It's pertaining to the basic needs. Schools have just a central role to play in breaking the cycle of generational poverty. And these health issues are going to stand in the way of doing that. So there's a need to address them. Schools have an enormous expectations placed on them. And you know, look at what goes on. Here we have a world-class city, right? World-class city. But why are so many of our schools a third-class public education? You know, look what happens in New York City. If you're wealthy, you're going to send your children to a private school. They're going to be in a classroom with 15 children and 2 teachers. And then they're going to have a chess coach. And they're going to have a fencing coach, and a dance coach, and an art teacher, and a music teacher. Or, if you don't, you know, you might be in a school with 35 children. Maybe 10 to 20% of them have special needs. And is the teacher in that classroom going to be the most experienced teacher? Where there's low rates of teacher turnover? So I think we have to be realistic about how we're investing our social resources. And just look at how, we don't really have a healthcare system. We have a disease care system. You know, so, you know, how much money are we spending in people's last year of life versus their first year of life? So it's a complicated story, and schools can't do everything, but they have an important and vital role to play. I don't know if I answered that question.
That works. And I guess in relation to that, you know how you mentioned, you know, let's say doing the eye exam right in the school. And with Harlem's Children's Health Project, which is right nearby, they integrate their health services in the school, and that really does help academic achievement, preventing attendance and things like that. So what do you think of a model like that across the nation where, like, let's say pediatrics and mental health, like everything's designed that it's incorporated into school?
Well, I'm a fan of full-service schools and community schools. I think that's a very sensible model, particularly in communities with great needs. It makes a lot of sense to me.
All right, those are my questions. Thank you.
Thank you. Sure.
Hello from the West Coast. And why is there an increased ADHD among lower-income single-parent families?
Well, that's a good question. The cause of ADHD is unknown. ADHD is an incredibly complex phenomenon. It's not a single entity. It's a syndrome involving different sets of symptomology. And the cause is unknown. And to date, there's only been one major study called the multimodal treatment study. And that study had quite disappointing results over the long term. And, there's a need for much greater understanding about that. So I'm sorry, but I don't know the answer to that question.
Thank you, Dr. Basch, for your discussion of how schools and education can support health outcomes. My question is related to school-based health clinics and what your thoughts are. So it's building on what the woman before asked. What your thoughts are about them, to elaborate on that a bit, the pros and cons, and what kind of support you see for that, or lack of support.
Well, I think in general it just makes so much sense to, you have a population of young people that are relying on adults to provide primary health care. And in many cases, that care is not being provided. So it makes a lot of sense to go to where children are to provide such services. They are in schools. It makes sense to provide those services while they are in schools. In some cases, it may not always require, there's a need for different kinds of models and different kinds of approaches. There may be not necessarily a clinic in every school, but in some cases it can be school-linked services in places where there are good, high-quality, community-based services available to just facilitate greater linkages between the school personnel and the schools. But it's vitally important. The key thing is that these services are provided and that the needs are met. It's just unfair that a 5 or 6 or 7-year-old child, can't see or can't sleep at night. That's not fair. Why is that happening in this country? So schools, I think, are the safety net that make the most sense because that's where they are.
I have a question, and it's just relating to, am I on? I guess now. It's, what are we doing? Because you have, I work in a Harlem community, and we have, we talk about all the schools, but what about the teachers that comes in to some of these neighborhoods? And what are your thoughts on, first of all, looking at the cultural part of it, especially when we have, teachers that are from a different culture trying to cope with our kids, and the kids accepting what's, you know what I mean? Because culture plays a very big role, and you just come in and, you might have, I'm in the medical field, and you might have someone who was going to school out in, the West Coast, and here we are, you need a job, so you come to Harlem. And what's your thought on that? I mean, to go back to say we need to give them that whole background to cope with some of these kids.
Well, it's no question that the effectiveness of the teacher is a critically important element. And to me, obviously if you grow up in the community and you know the community and the culture where you're working, you have a tremendous advantage in understanding and being able to establish rapport. But to me, the key issue is understanding and being able to establish rapport. Some people are able to transcend their own culture identity and make that connection because they want to. They make the effort to understand. And, I think that's critically important. The real problem we're facing is having sufficiently qualified teachers to work in the schools and who stay in the schools, and sufficiently qualified leadership in the schools that stay in the schools. The turnover rates in teachers is a serious problem. So, yes, sir.
Thank you very much. Thank you very much. Hello?
There you go.
Thank you very much. Excellent presentation.
Thank you.
I'm a product of public school education like yourself, and I'm a big believer of that. I wanted to know, I'm a pharmacist by training, but at the same time also a student in the School of Public Health here in Concord College, so not too far from here.
Mm-hmm.
And I wanted to know a little bit more in terms of where the innovation of education is going. Because right now, I'm not sure in terms of where the trend is, hearing that only Canada and the United States have a decentralized model. So we don't have a whole lot in terms of learning from other systems, perhaps because they don't have a similar system like we do, and only Canada we have something that's similar.
Mm-hmm.
So I'm curious to know what are the trends and where's the innovation that's coming from and going to where?
Mm-hmm.
Thank you.
Of course, good question. And I'm not necessarily an international expert, so I can't speak that much about some of the phenomenal work going on in places like Finland or Singapore. But from what I do know, there's a pretty big emphasis on using data now, and trying to develop things like John Belfance at Hopkins is conceptualized related to things like early warning systems and early intervention programs to try to identify children that are having problems early on so that the intervention can be provided at the earliest possible time. The other thing is, you know, the expectations are so high that people are increasingly recognizing that, you know, maybe we do need a longer school day. Or maybe we do need more time in after-school programs and summer programs, because a lot of slippage occurs. So I'd say, if I had to say what's the single biggest innovation, it's probably recognizing that there is no single biggest innovation. And that's a really important concept, and recognizing that when we're talking about academic achievement, it can be very idiosyncratic, and what's going to work well for one student may not work well for another. So therefore, we need multiple approaches and multiple strategies that might include a longer day, that might include summer teaching, that might include providing services at the school, greater linkages to the community, more parent outreach and education, different kinds of curricula, using data systems to inform the way we teach. And those are some of the things that are going on in other countries in the world that seem to be doing better than we are. Yes?
I have a comment.
Okay.
I agree that you said that communication is the key to success when it comes to health disparities, because if you can't communicate, how are you going to succeed? The more you communicate, the more you learn, the more we succeed. That's all.
Mm-hmm. Yeah. It's critically important. And that communication can come through different means. It can come, through, speaking like this, speaking at your religious organization, speaking to your elected officials, speaking in your schools, participating in your school board, getting involved. Lots of different opportunities. Thank you for your comment. Sorry, yes.
I probably came in.
See if you can turn it on.
Okay. I probably need education even for that. I probably missed, and the question may have already been answered that I'm getting ready to ask. The question is, what do you think happened to the education system? I'm a product of the segregated but equal in the South. My primary school years were from first grade to the sixth grade. And I remember the curriculum. Writing began at the very first grade, Palmer method. Second and third grade, by the time we reached the third grade, we were writing in pen and ink. And nothing, your homework was not accepted if it was in pencil, maybe math. By that third grade, I had studied geography. I knew where I was. The history of the state. European history. Fourth grade, it continued. But I had an interruption in the third grade. I went to Philadelphia. And I went to the new school system there. And just for a few months, and I had the second grade primer. The third grade primer was the second grade primer that I had in Winston-Salem, North Carolina. I went to public school, and the thing was they put you back in the, when you go from public school to Catholic school. I went to a Catholic, but my education was equal. We had diet, good health, and so forth. So I'm 78 as a result of that. So I'm saying, what happened? What happened to that educational system when it integrated? Thank you.
Well, I'm not sure I can answer that question. I'm not really an education historian, and would hesitate to try to just explain that. You know, the message I bring here today is that we're trying to do many different things to reform the educational system. And you can hear lectures about it here on almost a weekly basis. And the message I have to bring is that none of these efforts are going to really achieve their full benefit if students aren't motivated and able to learn. And these prevalent, highly prevalent health problems that disproportionately affect urban minority youth are going to jeopardize the effects of all of those different efforts.
I had a quick question. So you mentioned that there's no health regions, and I thought that's an interesting point. Can you comment on sort of the importance of raising health literacy and health education standards in terms of like children being responsible for their own health in that regard? Because there's a lot of pressure for the schools and parents, but maybe people should accept individual responsibility to a certain extent.
Say that again? That
perhaps people should accept individual responsibility or be aware of sort of their individual health issues.
Yeah, well, it's a false dichotomy, individual responsibility or social responsibility. You need both, but how are individuals supposed to learn if they don't have those opportunities to learn? You know, we're talking about, youth. And in school, in many cases, this is not really addressed in a serious way like it is. Imagine, look how much effort is put on reading or science or now, STEM curriculum. Well, there's a lot of effort. It's not something that's easy to learn. These are skills. And skills, whether you're talking about baseball or social emotional factors, it takes a lot of practice. And unless you're willing to devote the curricular time and energy and have skilled teachers, it's going to be really difficult for young people to acquire that individual responsibility. That's what we are aiming for. But in order to achieve individual responsibility, you really have to look at the social determinants and the social systems we have that either mitigate or support that kind of acquisition of those kinds of skills. Oh. Sorry, Deb. I'll answer your question later. Well, thank you very much.
Okay, well, let's give Professor Basch a hand.